Breast cancer is one of the deadliest diseases in existence. According to the World Health Organization, it is the most common type of cancer, with over 2.2 million cases reported in 2020, resulting in 685,000 deaths. In the United States, breast cancer remains a significant public health concern, with over 42,000 deaths reported annually. This disease continues to claim more lives in low- and middle-income countries. However, not all hope is lost. When breast cancer is detected early, it is highly treatable and remission is achievable, greatly extending survival rates. Unfortunately, many people are unaware of how to identify breast cancer in its early stages. That's why, by the time most are diagnosed, it's often too late. In today's video, we'll explain how breast cancer begins and the signs and symptoms you should know to detect it early. But before we dive into the details, make sure to subscribe to our channel and hit the notification bell to stay updated with our content. What is breast cancer? Breast cancer is a type of cancer that originates in the cells lining the ducts or lobules of the mammary glands. The disease arises when abnormal cells begin to invade surrounding tissue. In its earliest stage, called stage 0 or in situ, the cancer remains in its place of origin, making treatment relatively straightforward. Over time, if untreated, the cancer can spread to other areas of the breast tissue, lymph nodes, and even distant organs, leading to metastasis. Most breast cancer-related deaths occur due to metastasis, but this can be prevented if you pay attention to the early warning signs. 1. Changes in breast shape. Although every breast is different, most women and even men are familiar with the natural appearance of their breast tissue. If you notice changes such as swelling, enlargement of a particular area, or an overall change in breast shape that doesn't go away after your menstrual period, consult a doctor immediately. 2. Palpable lump. Feeling a lump or hardness under the skin is one of the most common signs of a breast tumor. Although not all lumps are cancerous, it's crucial to seek medical advice to rule out malignancy. You can detect lumps by palpating your breast tissue. It's helpful to compare both breasts, as this can help identify abnormalities. 3. Changes in the nipple. The nipple usually has a pointy shape, but if you notice it becoming inverted or retracted into the breast, consult a doctor. Inverted nipples can appear as a slit-like indentation or disappear entirely into the breast tissue. While this could be benign, it's essential to seek a medical evaluation. 4. Nipple discharge. Any discharge from the nipple, particularly if it's red, blood-tinged, yellow, or clear, should be examined by a doctor, especially if you're not breastfeeding. 5. Skin changes. If you experience unexplained redness, itching, swelling, or irritation on the breast skin that doesn't go away, it's important to seek medical attention. 6. Skin dimpling or retraction. If the skin of your breast begins to dimple or appear like an orange peel, this could be a sign of underlying issues, including cancer. Look for areas where the skin sinks in or forms small holes, as these may indicate changes below the surface. 7. Prominent veins on the breast. A tumor or inflammation can cause veins to become more noticeable on the surface of the breast. If this happens and persists, it's important to see a specialist. Early signs of breast cancer can be difficult to spot, so it's recommended that you perform a self-exam monthly to familiarize yourself with your breasts. This will help you detect any changes. If caught early, treatment is more effective and the prognosis is better. Later signs of breast cancer. Late-stage breast cancer signs are often those that were present earlier but went unnoticed or untreated, leading to a more advanced condition. These signs include a growing lump, nipple retraction, prominent veins, and sudden weight loss. Lymph node swelling under the armpits is also common in later stages. If you notice any of these symptoms, don't panic, but consult a doctor as soon as possible to confirm if the tumor is benign or cancerous. What are normal breasts? Normal doesn't mean one standard for all, as every person's breasts are different. The term normal refers to your breast's usual size, shape, color, and texture. This is why it's essential to know your own normal, so that you can identify any abnormal changes. How to do a breast self-exam. Performing a breast self-exam is easy and crucial. First, stand in front of a mirror with your hands on your hips and observe the size and shape of your breasts. Then raise your arms and look for the same changes. Next, lie down, placing one arm behind your head, and use your other hand to examine your breast in circular motions from the center to the armpit. Repeat on the other breast. Do the same while sitting or standing. Look for lumps, hardened areas, or unusual changes. Does finding a lump always mean cancer? No. In fact, more than 75% of breast lumps are benign, meaning they are not cancerous. Conditions such as fibrocystic breasts, fibroadenomas, and infections can all cause lumps without indicating cancer. However, it's always important to get any new lumps checked by a doctor to determine the proper course of action. How is breast cancer diagnosed? If you notice any changes in your breasts, a doctor will likely perform a physical exam and recommend tests such as a mammogram, ultrasound, MRI, or biopsy to determine whether the condition is benign or malignant. Based on the results, your doctor will recommend treatment, which may involve surgery, chemotherapy, radiation, or hormone therapy. Treatment for breast cancer. Treatment depends on the type and stage of cancer. Surgery to remove the tumor, known as a lumpectomy, may be recommended. If the cancer has spread, a mastectomy, removal of the entire breast, may be necessary, followed by chemotherapy or radiation to prevent recurrence. Life expectancy with breast cancer. The prognosis for breast cancer depends on the stage at which it is diagnosed. If caught early, the 5-year survival rate is 99%. If the cancer spreads to nearby tissues, the survival rate drops to 86%. If it has reached distant organs, the survival rate is around 28%. These numbers are estimates and not guarantees. The most important thing is early detection. Regular self-exams and timely medical checkups can make a huge difference in outcomes. We hope this video has been helpful. If you have something to add, please share it in the comments. Don't forget to like this video and share it with your family and friends so they can learn about breast cancer symptoms and prevention. If you're new to our channel, be sure to subscribe for more valuable health information.